first aid procedures. Why are we looking at this? We have realized that in the laboratory, inevitably, you might have an accident. Okay, it could be an issue to do with suffocation. It could be an issue with the burn. It could be an issue with an irritant chemical falling onto your skin. It could be something that perhaps get into contact with your eyes and things like that. So when the things happen, what do you do? Okay, and some of the things can actually even happen at home, not necessarily only in the laboratory. So if you find a victim with one of these issues, what are you going to do? Okay, so we are going to look at the different conditions and what you can do in those situations. Okay, so we are going to start with suffocation, and suffocation is basically the difficulty in breathing due to lack of oxygen, and this can happen in situations where you have inhaled a poisonous gas, okay, or in situations like in the laboratory, gas leakages can be one of the major causes. But basically what we are saying is that with suffocation, you are thirsty, in quotes, you are thirsty for oxygen. Okay, your body wants the oxygen, but you're not getting enough of it. Okay, and therefore we say you're suffocating. So what do we really need to do? For all the cases that we are going to discuss, it is very important that you understand what we call A, B, C, D. Okay. So what do they actually stand for? A stands for what we call airway. Okay, you have looked at the respiratory system, and you have noticed, or you already know that air enters through the nose and it goes through then the trachea, the bronchi, and then the bronchioles. So that is what we call the respiratory system or the respiratory tract in humans. Now, what happens when this airway is blocked? So the path taken by the air to reach the respiratory surfaces or the gas exchange surfaces is what we call the airway. So when the airway is blocked, you are going to, it's basically suffocation, causes you to suffocate, but eventually you will actually die. Okay, eventually you will actually die, and it doesn't take long for you to die if your airway is blocked. So therefore, the first thing is always to ensure that the airway is okay. There is no blockage. Okay, for any case that you encounter, make sure that the airway is patent. We use the word patent to mean that it is open. Okay, make sure that the airway is patent. Make sure it is open. And therefore, if there is no blockage, then the next thing that you need to check is whether the person is actually breathing. Okay, so breathing is often checked in our normal accident situations. You check if the chest is moving or if the nostrils are actually moving. Okay, or if you can feel that the person is actually breathing. Okay, Or you can also listen if someone is with, some people can have what you call labored breathing, and you can hear that with your ears. So you need to check whether they are actually breathing. Okay, and then the C is to check if the blood is flowing normally, what we call saturation. So B is breathing, and then C is what we call saturation. So you want to see if blood is moving. How do you see that? We check for the pulse. Often we use this part to check for the pulse. Okay, you check this. This is what we call the radio pulse. So you check for the pulse. You hear a pulsation. That means that the blood is flowing. So we have rates that we can use to say, okay, the pulse is normal or it is not normal, but that is not what we are going to look at. Okay, but basically, C is checking for if the person's blood is moving normally. That is basically if the heart is pumping the blood. This pulse that you feel here is because of the pumping action of the heart, right? And then D is treat the disability. Okay, if for example the person is having an issue to do, the person fell down because they did not eat, that means they don't have, most likely they don't have enough blood glucose in their, they don't have enough blood glucose. That is, they don't have enough glucose in their blood. Then you give them something that contains glucose, basically directly glucose. That means that you're treating the problem. Okay, so that's the D that you're talking about. Okay, or the issue to do, making sure that you deal with the disability, the issue that is causing the problem. Okay, so that is something that you should have in your mind in every situation where you have a victim. So, with the suffocation, of course, if you need to remove the patient or the victim from the source of the suffocation, such that you let them in a place, you put them in a place where there is free circulation of air, and that they can actually take in the normal air that they are supposed to be taking. Okay, and then making sure that the airway is open, such that the air can go into their respiratory tract, and then administer CPR with a clean cloth. What basically what we are focusing on here is you blowing air into this person. So you may need to cover them, and then with a piece of cloth or paper, and then blow that air into them. Okay, that is if after removing the person, you still see that the person is not improving. Okay, and then you can cover them up and take them to the nearest health facility. Okay. So we go to the next case. What I did not talk about here, before we go to the next case, what I did not talk about is the fact that carbon monoxide is produced when carbon does not burn completely. Okay, so you get carbon monoxide. So in our daily lives, if you have been cooking using a charcoal stove, and then that charcoal stove is inside the house, then you close the windows and the door, then you sleep off. Okay, that is actually dangerous. You can actually die. Why? Because there is not going to be enough supply of oxygen. Okay, and therefore when the carbon is burning, you get carbon monoxide. What does carbon monoxide do? Carbon monoxide competes with the oxygen to be carried by the red blood cells. So when the red blood cells, instead of combining with the oxygen, they combine with carbon monoxide. Yet the body actually requires oxygen, and eventually you actually die. Okay, so these are instances that have actually been reported in the news. Okay, so be very careful with cooking using a charcoal stove inside the house, especially at night, because the death that is caused by carbon monoxide poisoning is a silent one. You don't fight back because you're already asleep. Your body becomes weak, and you die off. Okay, so that is something that you need to take care of. Okay. And then also what I did not explain here, I think I had left it, is what we call CPR. CPR is actually cardiopulmonary resuscitation. Cardiopulmonary resuscitation. Cardiopulmonary resuscitation. So cardiopulmonary resuscitation is about enabling someone to recover from an issue that has caused their heart not to pump blood properly. Okay, so it involves what we talked about, blowing air into the person's airway. It involves chest compressions. Okay, that is what we call cardiopulmonary resuscitation. And the compressions is to make sure that compressions on the chest to make sure that the blood actually goes and such that the heart can pick up and start to pump normally. So we'll also look at that perhaps in the next presentation, such that you know how to do cardiopulmonary resuscitation. Okay, this can be very helpful for your relatives, for your young ones, in case they learn into issues. So cardiopulmonary resuscitation is an important skill for you to be able to save loved ones, and we shall look at that. So a burn, we all know what a burn is. When something that is hot gets into contact with your body, it could be your hand, it could be anything, you get an injury. Okay, so what do you do when you get such an issue? Lay the victim down, protect the burnt area. You can pour cold water for 15 minutes, for 10 minutes. This helps in reducing the pain. Okay, and then still monitor their breathing and their pulse, what we talked about earlier on. Prepare for CPR if there is actually need. Remove any things that can be restraining, such as the jewelry and other, maybe necklace, whatever it is, such that the person is actually free. And then you don't want the wound to get infected, so you make sure that you cover it with a sterile gauze. You remember the sterile gauze that we talked about? Yeah, the sterile gauze does not have any organism. Okay, so it is free of any organism, so it cannot cause infections. So that means that even placing it there, you need to place it properly so that you don't introduce the organisms yourself that will cause an infection to the burn. Okay, give pain medications, and you can refer to the health facility for further management. Avoid using ice and other ointments. They can cause other problems. Okay, so avoid them. Choking when your airway becomes blocked because of a foreign object. It can be food. Okay, so it's how do you notice that someone is choking? They start to actually get difficulty in breathing. They are coughing, so you know that this person is actually choked. So encourage them to cough. Sometimes the foreign object can get off, and if that does not work, you can hit on their shoulders and to make sure it comes out. But still, if it does not come out, you can perform what we call the Heimlich maneuver. Heimlich maneuver is a simple procedure, just like what you see here. The person performing the procedure is the one behind. So you stand behind the victim and then make a fist, and then use one hand to hold the fist around the person's just below the thorax, and then you pull in and upwards, or inwards and upwards, to make sure that the foreign object can be dislodged. Okay, so you repeat the procedures until it gets out, and you can transfer the patient or the victim to the health facility for further evaluation. Bruises, these are skin injuries that can happen on any part of the body. Okay, so the impact is not usually much, but you have some superficial blood vessels that can get damaged. Okay, so cold decompresses can help in relieving the pain and the swelling. Okay, and you can, if it happens to the leg, you can elevate the leg or even the arm. Why do we elevate? Is that it helps in reducing the pain, the swelling actually. It helps in reducing the swelling because the drainage is faster. So you don't have fluid, but the fluid is accumulating. Okay, so it will reduce the swelling and therefore the pain. Okay, you can still evaluate after 48 hours and still apply warm cloth twice a day. Okay, until the healing happens. We come to shock. Shock is actually dangerous if a patient if we have a patient or a victim of shock. It means that we need to act very fast, such that they can actually recover. If you don't act fast, we might lose them. So shock is caused by many factors. It could be bleeding excessively. If someone gets a cut and then they bleed excessively, they go into what you call shock. Okay, it can be that the person gets into contact with a chemical that causes them an allergic reaction. They can go into shock. Okay, so the shock is something that requires prompt treatment. So what do we need to do? If it is shock that is caused because of bleeding, we need to arrest the bleeding. So tying one's leg or arm, if it is the one bleeding, can help. If someone has a cut here, you tie around here to make sure that no more blood is lost. Okay, if it is the leg still, you tie just above the point where bleeding is happening. Okay, and then if you, of course, taking them for treatment is very, very, very important. Okay, first aid is very important, but also making sure that they receive prompt medical care is very, very, very key. Okay, and when they reach the health facility or while you're transporting them there, make sure that the legs are raised to make sure that blood can flow back to, especially the head. The head requires blood, and in shock, you want to make sure that blood flows back to the head. The minimal blood the little blood that is remaining goes to the brain. Okay, that's something that you want. For all cases of accidents, usually you need to transport them in. We have covered them. Okay, to keep them warm, that is quite very important to note. Okay, touching electric wires with your bare hand is something that is very dangerous because you can be electrocuted. So you get what you call electric shock, and this can result into death. So be careful with sockets and wires. Be careful with them such that you don't land into this problem. So what happens if you find someone who has been shocked with electricity? We usually, for every case, make sure that you are safe. Your safety is very important. Okay, your safety is very important. I cannot emphasize that more, but your safety is very important. So before you touch anything, make sure that you're doing the right thing. Okay, make sure that you are not touching the same wire that actually electrocuted the person. So switch off the source of the electricity. So that means make sure you clear the environment such that there is no other hazard around. Okay, if you're not very sure, you can use a non-conductive material to move the person away from the wires. If there are many wires around, you are not aware which one has electricity, which one does not, then you can use something to move them. An insulator, okay? It could be a wood, it could be something plastic that can allow you to move the person away, okay? Don't use anything that can allow electricity to pass. Don't use any metal, okay? Yeah, so after getting the person away from the dangerous area, then you can use the ABC to check airway, breathing, check circulation, and position the patient well. If you have any injuries, any burns, you can give first aid and then transfer to the medical facility. Okay, and then this is also very important. If the area is of high voltage, it could be very important to avoid. Okay, this still comes to the fact that you don't want to also put yourself at a very huge risk. Okay, so it is very important to take into consideration those issues that have raised. Find someone who has lost consciousness suddenly. They are not aware of what is happening. It means they have lost consciousness. This is what we call fainting, sudden loss of consciousness because of inadequate supply of glucose, of oxygen, or supply of blood. Of course, blood carries the nutrients plus oxygen. Okay, so someone can actually faint because they have not eaten. This is because they don't have enough glucose. Okay, the brain requires glucose for it to function, and if it does not receive the glucose, it means you can easily lose consciousness. So loosen the person's clothing, elevate their legs, transport them to the health facility as soon as possible. Bleeding, it could be because of a cut, it could be because of a gunshot wound, it could be because of many issues. This bleeding can be categorized into two. It could be heavy bleeding or light bleeding. Okay, for all cases, regardless of whether it is light or heavy bleeding, what we call severe bleeding here, make sure that you put on gloves before you touch the patient. This is to avoid spread of infections. You don't want to get an infection from the patient. Okay, so make sure that you are well protected. Put on what we call the PPEs, personal protective equipment. It's very, very important. Prevent infection by cleaning the wound, and also arrest the bleeding. Okay, arrest the bleeding, and then take the patient for medical evaluation. Arresting the bleeding in this case is what I explained earlier on. Use a bandage to tie the part above the bleeding part. Okay, such that they don't lose blood. When they lose blood, they go into shock, and we have just noted that shock is actually dangerous. Okay, so you don't want to have such situations. But again, avoid getting infection, but also make sure that you don't introduce infections into the victim. That's very important. You could be playing around and then someone knocks on your nose and then you get what you call nose bleeding. What do you do? Loosen the clothes, sit the person with the head tilted forward, and then pinch the nose while the person is bleeding via the mouth. Okay, pinching just this part here, such that the bleeding stops. Okay, if it doesn't, then you need to go to the health facility for evaluation. Okay. So when you reach the health facility, a number of procedures can be done to arrest the bleeding. Okay. And then poisoning. Okay. Poisoning is when you take in a harmful substance that will affect the normal function of your body. That substance can be inhaled, it can be ingested, or it could be a substance that gets into contact with your body or your skin. So how would you notice? There are many signs. Different poisons manifest in different ways. Others will start by vomiting, abdominal cramps, pain, breathing difficulties, diarrhea, or you have abnormal skin color. Okay, so for poisons, call for medical assistance promptly and take the person to the health facility. Some of the poisons, some cases it could be someone who wants to commit suicide, so they take poison. Okay, if you know the poison, please, if you suspect that there's a container that contains the poison, then you talk it together with the patient to the health facilities so that the health workers can know what medication to give. Okay. So depending on where the poison enters your body, there are different things that you can do to minimize the extent to which the poison enters your body or enters your bloodstream. So if it is the eye, flushing with water can help in washing out the poison, but don't rub. Rubbing instead makes the poison enters more. And then the skin, remove the cloth and rinse the part with water. Do not apply any ointment. Ingestion, that means those that you have taken through the mouth. You can only induce vomiting, that is, you can only make the person to vomit if you are very sure that the poison is not a corrosive poison. Corrosive is when that damages the cells. That poison damages the cells that it gets into contact with. So if the poison is corrosive, you really need to avoid inducing vomiting. Okay. And then of course some of the antidotes I mean, some of the poisons have their antidotes. If you take this poison, there is a drug that can be used to treat that poison. That's what you call an antidote. Okay. And then inhalation. This is to say the patient inhaled the poison into their body. Just make sure that you remove them from the source of that poison, and then, of course, take them for medical evaluation. And then vomiting, which is the forceful expulsion of the contents of the stomach. The causes of vomiting are quite many. Okay, it could be poisoning, it could be toxic fumes, could be overeating. Usually, the complication is that you lose a lot of water, so you get dehydrated. Okay, therefore, you need to be given a lot of fluids. Okay, for such that your body does not go into dehydration. So you're given rehydration drinks to replace what you have lost. If the vomiting persists, you really need to take the person to the health facility. Sometimes the vomiting, the vomitus contains blood. Sometimes you have other accompanying symptoms like fever. So take them to the health facility. So that marks the end of this presentation. We have looked at the different conditions that can happen, whether in the lab, whether at the school, whether at home. What is very important is that you rescue these victims by performing the necessary techniques or procedures. Okay, it's very important to ensure that you are safe before you touch any patient or any victim. But also, don't forget that we usually use ABC to help us to intervene. It is very easy to help any patient if you know what we call A, B, C, D, which is that we check if they are breathing okay, that is the airway is fine, and that the breathing is okay. You check the circulation, and then handle the issue that is causing the disability. That is the ABCD approach. It works for any of the cases that you can find.